141. Your patient is a 5-year-old girl who presents with breathing difficulty of rapid onset. She is sitting upright and drooling. Her temperature is 104.6 degrees Fahrenheit. What should you suspect? A. Bronchiolitis. B. Asthma. C. Croup. D. Epiglottitis. Answer. D. The signs and symptoms of epiglottitis are given. 142. An injury to the brain opposite the site of a blunt force impact is called A. Contralateral. B. Concussion. C. Contracoup. D. Coup force. Answer. C. During significant force to the head, the brain can shift and strike the opposite side of the skull away from the original force. This mechanism can cause a contracoup injury. 143. One way to determine the size of the endotracheal tube to use in a child is to use the following equation: 16 plus the child's age divided by 4. Another consideration is the size of the child's A. Glottic opening. B. Pleural space. C. Pharynx. D. Cricoid ring. Answer. D. In addition to the child's age, the size of the endotracheal tube should be based on the size of the cricoid ring, which is the narrowest part of a child's airway. 144. What should you do in order to preserve physical evidence in cases of suspected sexual assault? A. Examine the patient's perineal area carefully. B. Bag all soiled articles of clothing together. C. Avoid cleaning wounds and handling clothing. D. Have the patient change clothes and bathe before transport. Answer. C. To preserve physical evidence, avoid handling clothing and cleaning or bandaging wounds, unless there is hemorrhage. Do not allow the victim to bathe, comb her hair, or change her clothing. 145. A 17-year-old male complains of a steadily worsening headache several days after being struck in the head during football practice. Which of the following injuries best describes this patient's presentation? A. A concussion. B. Subdural hematoma. C. Epidural hematoma. D. Subarachnoid bleed. Answer. B. A subdural bleed occurs when a small vein bleeds into the area below the dura mater. It may take some time before pressure from the bleeding is high enough to cause clinical signs and symptoms. 146. When should you examine a woman who is about to give birth for crowning? A. During a contraction. B. Between contractions. C. During an internal pelvic exam. D. Only when time permits. Answer. A. Look for crowning, or the appearance of the baby's head at the opening of the vagina, only during a contraction. 147. Your patient is a 32-year-old woman who reports that she is 14 weeks pregnant. She complains of abdominal cramping and vaginal bleeding. How should you proceed? A. Perform an internal vaginal exam and treat her for any signs of ectopic pregnancy. B. Administer high-flow oxygen, monitor fetal heart tones, and transport immediately. C. Treat for signs and symptoms of hypovolemia, provide emotional support, and transport. D. Position the patient supine, open an OB kit, and prepare for emergency delivery in the field. Answer. C. The patient is most likely suffering a miscarriage. Treat her for signs and symptoms of shock due to blood loss, provide emotional support, retain any clumps of tissue she passes, and transport. 148. What is the cause of the supine hypotensive syndrome in the pregnant patient? A. Pressure of the uterus on the inferior vena cava. B. Normal volume depletion during pregnancy. C. The occurrence of abruptio placentae. D. Abnormal fetal presentation or positioning. Answer. A. Supine hypotensive syndrome, a normal occurrence during late pregnancy, is caused by the pressure of the pregnant uterus on the inferior vena cava when the patient is supine. 149. Which of the following is a differential sign or symptom of spinal shock associated with trauma? A. An elevated heart rate. B. Decreasing blood pressure. C. Anxiety or sense of doom. D. Warm, dry skin distal to the injury site. Answer. D. While the other answers are signs and symptoms of shock, only choice D reflects a specific sign that points directly to the underlying cause of hypoperfusion. 150. During a normal delivery, you would tell the mother to stop pushing when what occurs? A. Crowning begins. B. The head is delivered. C. Delivery of the infant is complete. D. The placenta is delivered. Answer. B. To avoid a precipitous delivery, tell the mother to stop pushing after the head is delivered. 151. What is the appropriate treatment for a prolapsed cord? A. Attempt to push the cord back into the vagina and deliver the infant normally. B. Place 2 fingers on either side of the baby's nose and mouth and lift the head until it is delivered. C. Place 2 fingers to raise the presenting part of the fetus off the cord. Place the mother in knee-chest position, administer oxygen, and transport. D. Assist and support the mother for a normal vaginal delivery. Answer. C. A prolapsed cord should be treated by placing 2 fingers of a gloved hand to raise the presenting part of the fetus off the cord. Then place the mother in Trendelenburg or knee-chest position, administer high-flow oxygen, and transport immediately. 152. Immediately after delivery, how should you position the neonate? A. Higher than the mother's vagina, with its head slightly elevated. B. At the level of the mother's vagina, with its head slightly lower than the body. C. Lower than the mother's vagina, with the head at the same level as the body. D. At the level of the mother's vagina, with the head slightly elevated. Answer. B. Position the neonate at the level of the mother's vagina, with his or her head slightly lower than the body to facilitate drainage of secretions. 153. A patient who complains of a sudden and painless complete loss of vision in one eye is most likely suffering from A. Acute retinal artery occlusion. B. Retinal detachment. C. Conjunctival hemorrhage. D. Hyphema. Answer. A. The retina captures the image that is projected by the lens of the eye. It can spontaneously separate from the inner surface of the eye, causing sudden and painless loss of vision. 154. The first step in the resuscitation of a distressed neonate is to A. Ventilate with 100% oxygen for 15 to 30 seconds. B. Administer Narcan. C. Evaluate the respiratory rate and breath sounds. D. Initiate chest compressions. 155. All but which of the following statements about supplying supplemental oxygen to a neonate is correct? A. Do not withhold oxygen from a neonate in the pre-hospital setting. B. Oxygen toxicity in the pre-hospital setting is a serious concern. C. Administer supplemental oxygen by blowing it across the neonate's face. D. Oxygen should be warmed if possible prior to administration. Answer. A. Ventilate with 100% oxygen, and then evaluate the heart rate and initiate chest compressions if necessary. Answer. B. Oxygen toxicity occurs only if oxygen is administered for several days. Do not withhold oxygen in the pre-hospital setting. 156. How much intravenous fluid should you administer to a distressed neonate who weighs 2 kilograms? A. 10 milliliters. B. 20 milliliters. C. 30 milliliters. D. 40 milliliters. Answer. B. Fluid therapy for a neonate consists of 10 milliliters per kilogram equals 20 milliliters for a 2 kilograms neonate, administered via syringe over a 5 to 10 minute period. 157. A patient was hit several times in the left chest with the large end of a pool cue. The patient is in severe respiratory distress with tachycardia and tachypnea. Crepitus can be felt over the left anterior 4th, 5th, 6th, and 7th rib area. Lung sounds are clear and equal, but diminished. Which of the following conditions best describes the patient's presentation? A. Flailed chest segment. B. Tension pneumothorax. C. Pericardial tamponade. D. Pulmonary contusion. Answer. A. Flail segment is very possible in this case due to the mechanism of injury. The lack of other signs or symptoms, such as jugular venous distension or unequal or absent breath sounds, minimizes the possibilities of a pneumothorax or tamponade. 158. Which statement describes a tiered EMS system? A. Paramedics are the pre-hospital team leaders, and they supervise lower-level BLS providers. B. Physicians directly supervise all aspects of care provided by pre-hospital personnel. C. Varying levels of resources are dispatched to calls, depending on the nature of the incident. D. After they arrive at the hospital, patients are assigned a priority for care by a triage nurse. Answer. C. A tiered EMS system is one in which varying levels of resources are dispatched to calls depending upon the nature of the incident as determined by the 911 dispatcher. 159. A patient is found lying supine on the floor with a stab wound to her right anterior chest, just below the breast. The patient is having difficulty breathing with cool, clammy skin signs. No JVD is noted. Breath sounds are absent over the right side. This patient most likely is experiencing A. Pneumothorax. B. Pericardial tamponade. C. Tension pneumothorax. D. Hemothorax. Answer. D. The lack of jugular venous distension in the supine position is very telling. It suggests a large loss of volume from the circulatory system. 160. Which activity is an example of indirect medical control? A. A licensed physician who does not work in the EMS system assumes control at an accident scene. B. A paramedic administers nitroglycerin to a patient with chest pain under standing medical orders. C. A mobile intensive care nurse communicates orders to paramedics while en route to the hospital. D. An EMS physician tells a paramedic on the radio to administer morphine sulfate to a patient. Answer. B. Indirect or offline medical control is any EMS activity that involves medical, physician, input either before or after, but not during the care of the patient, e.g., standing orders, run critiques, quality improvement.